So, greetings, friends and followers. This is Nurses Talking. I am Dale Barzi. And as always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today, I have the very great pleasure of welcoming Elssy Abi out of Kuwait. Elssy is a nurse for more than 17 years now. She currently is a home care manager. She has been an educator. She is an active member of the Joint Commission Accreditation Prep Committee. She's currently pursuing a master's in education and health promotion, and she's an internationally educated MBA. So, welcome, Elssy.
Thank you, thank you. And thank you for for your time. And I'm very happy that we can today discuss and share our what we feel about nursing and what is nursing for each other and our different experience. Because yeah, literally, I've been in different country, so so we can share our experience together. Yeah.
Yes, yes, indeed. Yes, indeed. And that's the goal of this. And I'm so appreciative that you're doing this. But tell me first of all, what brought you to nursing?
Uh, what brought me is my mom. I think many of us is the same. But me, because my father passed away when I was 1 year old, and he passed away due to medical error during procedure. So my mom was deeply traumatized, and she wants someone in the medical field, so she to feel more safe whenever she needs to go to any hospital. My sister applied at the beginning, but she couldn't tolerate it. And after I applied, I didn't love at beginning, but with time I find it's my call, and now I really love nursing.
But this was your mother's dream. This was your mother's thing because of what happened. Um, did you have any ideas to be anything else, or did you just want to follow
Yeah,
that?
yeah. I wanted to have to do business, and even I because I was even I do my exam, and I was accepted in the business university. But after I change, I said to my mom, if I will, because I study in governmental university, and
Mhm.
in Lebanon to succeed in any exam for governmental, sometimes it's very difficult. So I thought that, okay, I will try to nursing. If I succeed, I will go. And I succeeded. So I transfer to nursing. But at the beginning, I want to do business. That's why after I do business management. So I have like a, a balance between what I wanted to do before and what I have done.
So how though? How did it? What were the challenges for you?
I had literally many challenges. Yeah, many challenges. It began with me when I was a trainee. I have like confidence issue because always I was afraid to do any mistake that can affect people's life. And it's because it affect my life that my father
Yes.
was died
Yeah.
from medical error. So it was I was always afraid at the beginning when I was a trainee. But thanks to my teachers and the senior nurses I work with, they helped me to gain my confidence. And with time, I become more experienced. And after, it's what I teach my nurses now, that
Mhm.
when you are afraid and you don't trust yourself, you make more mistake. So confidence is something you need to learn how, because
Yeah.
nursing need confidence and need that you
Yes.
trust yourself.
Yes, 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 because you know what, there are many, many times when you're going to have to make a decision in the moment, and you're going to have to know that you're making the correct, you have the confidence that you, with what you have to work with the evidence in front of you, you're making the correct decision.
It was one of my challenges. If I will speak about others, I can. I have a list. I will tell you
Yeah,
one or two. I will tell you one or two. One
yes.
also, I think one also, it's not only me. It's one of the main challenges of all nurses, our workload and our lifestyle. Because I've been working in Lebanon, we work 12-hour shift, not 8 hours. Okay, you have day off, but you work 12-hour shift and never you finish at 12 hours. So it's like 14 hours on daily basis. So, and I worked 10 years night shift. between, and holidays, weekends.
Mhm.
So in a moment in my life, I feel so isolated because whenever you want to do something, your friends are working. Whenever holidays, you are working. So it affects me socially that I feel many times isolated. And many people, even if you are in any relationship, many people cannot accept that you are not here.
Mhm.
They want
Yeah.
normal life. Women, especially in Arabic countries, men
Mhm.
always request that woman, she will be available for him, not vice versa, to be available for her and to
Yes.
take into consideration her schedule and her job requirement.
Yeah. 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 I understand. I understand that, and I understand that feeling of isolation. Yes, I get it. Yes, I get.
And And
Yeah.
yeah, and one of the most challenging, not only for me and for many Lebanese also nurses, you need to know about it, that we work in war episodes many times because Lebanon has many work episodes. And sometimes it was not risky to go work, but even though we continue and we went because we know that many people depend on us. And it was very overwhelming. It was very challenging mentally and physically for us. And especially, I can tell you my last experience, it was when the Beirut explosion.
Uh,
I was in the area where it was exploded, and my hospital was deteriorated. And we've been working more than with people, and at the same time we don't have capacity because everything was ruined. So it was, I can say, it was my most challenge as a nurse. But it helped me to make me stronger, more resilient as a person.
mhm,
And now
mhm,
I find
mhm.
many things easier in life.
Is there anywhere you can go, for example, to debrief after one of these things?
During explosion, last one, many associations come from outside, but it was a group debriefing.
Uh-huh.
For me, I went by myself too because I feel after it, because it was very devastating for me. I've been working in many episodes, but this time because literally we feel that I can do something, but I cannot have the capacity because everything is ruined around me. And
Yes.
it was like very overwhelming because you are going and it was like a city ruined and you need to try to help people as much as possible. People shouting, people crying, and it was not something easy. And so I want and ask for the help with the mental health, but not by my hospital or not by government, because I do it by myself because I stay more than 1 month not able to sleep because even though I've been working in many episodes and I have been seeing many, but it was like a bit trauma for me, the Beirut explosion, because literally it was not like in a hospital, it was a city ruined. So,
Yeah. I see, to shift a little bit, I see you have such vast experience. You've been an educator, you've worked dialysis, oncology, med surg, all kinds of things, all
yes,
kinds of
yes.
things. So having done all of that, what made you decide on home care as a specialty?
I've been working home care as a part-time during when I was in Lebanon, and it was like an opportunity. But I love working with home care because I will tell you why. Home care, you feel that you're having time to your patient more than in hospital. In hospital, you have 8, 9 patients. You are running doctors. Or in home
Everybody.
care, yeah, in home care, first you see the patient as a whole. You see him in his comfort zone. You see in his environment. So you can help him not as medically wise only. You can help him physically, emotionally. You can understand sometimes his fear because you see his environment. You see, and sometimes you don't only work as a nursing when you go home care. You change the environment. You work a bit occupational. You work mentally,
Yeah,
and
yeah.
you work education. you for the family and the patient, and you will be the support system for the family, because many cases we have, it's very overwhelming for the family. Like when you have a patient Alzheimer, when you have a patient palliative care,
Yeah.
it's literally overwhelming for the family. And
Yeah.
as I'm a religious person, I like to help in this part, because sometimes people need to someone to listen,
Yeah.
and at home people feel comfortable to speak and to give you what they feel inside you. You have more time to be a nurse.
So what do you think though that you would like to see change about nursing in general?
I will speak about my experience between Lebanon and Kuwait, because
Hmm.
maybe outside is different. So, uh, as us, so I know how much I work, and how much we have workload as a nurses in Lebanon. I like to feel that nurses are more appreciated, and they are more valued as a nursing. Because yes, we are a big part of the medical health system, and without us, medical system cannot work. And I like that it's coming, but I like that the nurses have more, not initiative, have more decision making, because still in Lebanon we don't have nursing practitioner, we don't have this part of where nurses can have be decision maker. We still do what the doctors prescribe. For
Hmm.
sure, they take into consideration what we say, our multidisciplinary.
Hmm.
But as a nurse, we are not decision maker, or we are not
Hmm.
in this step. So I like that the nursing involved more in Lebanon. As a Kuwait, they try to change a bit. The workload is less. It's 8 hours in hospital, and they have the capacity to bring extra nurses, so the burnout is not here. But for home care, still long time shift, because you cannot send every 8 hours nurse.
Right.
Yeah, so it's still long
It's a
shift,
long
long
shift.
shift.
Yeah.
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 So for me, make valuing the nurse something very important for me, because literally we give from our life, from our time, and literally
Everything.
we save people. So nurse must be valued more than this.
Yeah, yeah, yeah. We have the same struggle here, Elsie. I promise you. It's not just that we have the same struggle here. What do you think you see nursing looking like in the next 10 years or so? Because I noticed that there have been so many changes in the last 10 to 15 years. It's literally exploded. What do you think it looks like 10 years from now?
Like I told you, I feel positive about what a
Mhm.
nurse will be, because if nursing will not evolve, we'll not have so much nurses with time, because it's a profession very nice, very beautiful, very humanitarian, but also it's a hard work.
Very hard.
So yeah. So for me, I see the nurse is evolving with time, and I'm seeing that she's becoming more specialized, because sometimes when you are specialized, it gives you your value. You feel that you
Hmm.
have a value. I'm not only nurse, I'm specialized in this, I'm specialized in this. I can have more the income when I speak, because and she's becoming more independent. Now you are seeing everywhere entrepreneur nursing, you are seeing nurses
Yeah.
in a different field, in the community field, public health, research, and so nursing are evolving. And I'm seeing with time, she will be, يعني, I think we are going, we have like a
Yeah.
career left with time.
Yeah. 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 Yeah.
I will share with you a bit of experience. I feel it. When I was in Lebanon, for sure I was under the doctor, but I was in a part of my time, like I have a small clinic for me. I was heart failure educator. People come to me. I do therapeutic education, and this let me feel more confident, more that really I'm not only one known by wound care and anything. I
Exactly.
I have my career ladder, and
Yeah. 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 And you had a lot more autonomy in that area.
yeah, I had more autonomy because, yeah, so it made me feel more satisfied and more fulfilled in my part of nursing in this part.
Exactly, exactly, exactly. So, Elsie, what advice, having all of this experience, what advice would you give to someone who wants to be a nurse?
Okay, I need to tell them from the beginning. They need to know it's a hard job first. If she's not willing to put effort, if she wants easy money, it's not nursing first. And second, it's a humanitarian part, a job. If you don't have the compassion, the empathy, and if you don't know that you need to take into consideration always that your patient, his family feelings, and uh, don't be a nurse because nursing is not giving medication, giving this now with the technology. I don't know if after we will have robot, you can do it,
Hmm.
but nobody can replace this humanitarian part of nursing.
Yeah,
If really someone thinking that because I can get like a big amount of money, I want to do nursing. Nursing is not like this. Really, you need to be involved and you need to love this job because with time, sometimes you feel one day, I hate it. But literally,
yes,
because you love your patient, you feel how much you can affect people, how much this job, how much sometimes you are saving people. And to give literally from your heart, that's what can let you continue. Because
yeah,
literally sometimes you feel, خلاص, I cannot, I'm
I
tired.
cannot. Yeah, I
But
know.
but what makes you continue? It's your love and your humanitarian side. So if a person is thinking only economically about nursing, it's not for him
Hmm.
first. And secondly, nurse need to know something because we are in continuous education. So you need to have this will to have continuous education. It's not like you do accounting, for example. Maybe from time to time there's
Hmm.
a new thing you
Hmm.
need to know. But nursing on daily basis, you are in
Every
continuous
day.
education. So people also need to know that they need on daily basis, on yearly, always to make themselves better. And so for me, nursing is not for everybody. So
It's not.
whenever someone come to me, sometimes because I was a clinical educator and I was teacher, I teach
Hmm.
nursing as an orientee. So literally, you need to explain this for the nurses before they continue. Are you willing? Are you willing to sacrifice? Are you willing to understand people? Are you willing to understand even sometimes you are so tired, but you need to continue to smile and to give from your heart to your patient?
Yeah.
Because
Mhm.
if you are working only to give medication and IV and it's not nursing.
That's just a task.
When I was teaching, first I tell the nurse, communicate. You are not only here to put IV.
Yeah,
Sometimes during IV, you can know many things about your patient, and he can,
exactly.
yeah, let's see, tell me what's happened to you, how was your night, and you make this task easier for him because our tasks sometimes are painful. So
Unpleasant.
yeah, so
Yeah.
and sorry to speak a lot, but I will give one of my experience. As I told you, I'm a religious person, so and I believe that you need to support people while dying, or
Yeah.
so I support many patients because I was working in oncology department, and one time I was in. I have a patient. He was alone. You know, he take care of his wife, his mom all his life. He didn't get married, and he was dying alone. I couldn't be with him all the time, but I give him the rosary and I spend with him and I pray with him and I told him, don't worry and everything. So some of his cousins come and give me back the rosary when he died. And he told me, literally, he told me about you. You affect him a lot and he was happy when he was having the rosary with him.
Hmm.
So literally, it affect me. And this, for me, what is nursing? How
Yeah.
you can change people's life, how you
Yeah.
can, in small smile, make literally a patient who suffered more happy. even
Yeah.
for a while, you know.
Yeah. 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 Exactly. Exactly. You've got to that empathetic thing, you've got to have it. If you can't have it, you can't do it. You can't. What does self-care mean to you and how do you care for you?
Okay. This question make me laugh because all my life I have issues with my self-care. Lately, I'm obliged because my body now tell me you need to pay all this negligence. Yes. Now I understand better that to care about others, you need also first to care about yourself because you cannot continue if you don't care about yourself.
Mm-hmm. Mm-hmm.
And this, because you know, you've been in nursing and you know that being night shift, for example, how much affect your health
Yeah.
between your hormones, your
Yeah.
insomnia, other topics. So, and I was a very strong woman. So I continue, I force myself, I
Mm-hmm.
continue. So I think first thing I learn in self-care is that I need to stop and to listen my body first. And second, I need to try to disconnect because you know now I'm in a managerial post, so I have patients who can call me anytime because
Anytime.
you can have
Mm.
any incidents, any people. So literally sometimes I cannot disconnect, but I'm trying as much as possible to have time to myself to disconnect and to be with positive people to change my mind. Here in Kuwait, I have an area I can walk. Sometimes I wake up early, I go walking next to the beach or directly next to my house. I go here, the food is very tasty, so the restaurants are always full and we are always in the restaurants. So yes, I'm trying to find to read a book, but what is now I think more important for me is self-care. It is my wellness as a whole. I'm trying to work now on my wellness, not only because everything affects everything. So
Yeah.
if you are mentally not good, your body will tell you.
Yeah.
If your body is not good, you will feel more tired.
That's right.
So and this topic's wellness is very well known here in Kuwait. So I learn about it here in Kuwait because everybody speak, and especially I work in a company where we are multidisciplinary. We have mental health, psychiatry, rehabilitation. Before also we
Mm-hmm.
have yoga. So always we speak about wellness, and it make me also understand that self-care is wellness in all
Yes.
mentally, physically, emotionally, and so
Yes.
I'm trying my best. One time when I was studying public health, you know, they have the occupational therapy, and they tell you every work what you can have like injuries or
Mm-hmm.
you can have illness. I have it all, but what related to nurses. That's why now I'm working on my wellness.
Indeed,
And that's why
indeed.
I told you I make attention to this late, but I hope it's not too late.
It's not too late. It's never too late. It's never too
Yeah.
late, Elsie. Thank you so very much for this conversation, Elsie. I have truly enjoyed it. Are there any last words you'd like to leave us with?
Thank you for the opportunity, and I hope always that we have nurses talk and we have nursing empowerment because for me, literally, nursing is noble. I don't know if in French or humanitarian
Mm-hmm.
job, and it's something it can affect people's life. So, as much as we value nurses, as much we empower nurses, as much they can give. So nursing must be valued more than this for me. I don't know
Yes,
what's
indeed.
your
Yes,
point of
indeed.
view.
I,
Yeah,
I agree with you. I agree with you. And that really is one of the reasons that I do this. Because I think I need nurses to see other nurses doing things. And I need the people we serve to see us differently and value us differently. So that's one of the reasons I do this. So yes, I agree with you.
yeah. So
So thank you so much, Elsie. I truly appreciate this. And for those of you who are watching, if you would like to be a guest on Nurses Talking, Please get in touch, nursestalking@gmail.com, and we'll listen to Elssy.
Thank you. Thank you again.